20 to 30% of the students in the elementary schools and in the middle schools and the high schools are on antidepressants, focus medications, anti-anxiety medications. It becomes very clear that we're really in an epidemic. I have actually had students who are entering college coming through our doors asking for prescriptions of Adderalls because everybody who's using them is getting good grades. So it's become almost a cultural sign of our times. Yes, it may be what we're doing standardly to basically address a symptom, but not necessarily get to the causes.
Anxiety often starts from both external and the internal stimulations that use fuel in the body. Fuel being simply the hormones and the nutrients. These external stimulations could be things we choose to do, associations we choose to keep, things we choose to be exposed to, and/or emotions that we choose to engage. Examples would include things like the phone buzzing, toxic people or thoughts, driving in traffic, driving at all, turning on a light, making a commitment, and even a gentle walk. The internal stimulations have to do with the way in which we process these external stimulations and what effect they actually have on our internal body. Each one of these stimulations have one thing in common, and that is that each one stimulates the nervous system to fire. When the nervous system fires, it starts to use your fuel, like magnesium, B12, and most importantly, your cortisol pathway. When the cortisol pathway, or rather the stress pathway, is overloaded for long periods of time, we start to see anxiety, depression, and even fatigue. One of the things we see also when people are having anxiety and depression is not only, low motivation, low test scores, inability to keep a list and do things, being overwhelmed, not being able to get as much done as they could, but also we see a lot of consequences of that are down the line because they reflect the imbalances. Eventually, these imbalances can turn into a host of possible symptoms and diseases, including heart racing, palpitations, hyperventilation, panic attacks, being overwhelmed by small things, social phobias, a desire to withdraw, and tiredness and depression. Physical conditions that go along with this include irritable bowel syndrome, allergies, rashes, skin conditions, sinusitis, body pain, arthritis, and even stubborn weight gain. To restore calm, you must correct these underlying imbalances by measuring and optimizing the hormones and nutrients, or the fuel tank, while simultaneously working to reduce the speed of the engine or the physical and mental stressors. I would like to leave you with these first steps that have been tried and proven in thousands of patients that you can start now. 1. Reduce both physical and mental activities while filling your fuel tank. This means commit to restoration in nature, meditation, joy, sleep, water, deep breathing, and following your heart in all things. Learn and practice heart-focused meditation or heart math for 5 minutes twice a day. This technique is being used by Fortune 500 company executives to reduce the drain of the fuel tank and increase the resilience and performance. Second, correct the hormones, progesterone, testosterone, thyroid. Often we're told that our lab's in the normal range. Normal range means it's between the 10th and the 90th percentile, whereas protective levels are above the 75th percentile. In women, progesterone has such a profound effect on anxiety and sleep that it is the only hormone my patients call in for as an emergency when it runs out. What are some of the supplements that I find critical? The number one supplement is Magnesium RX. This plays a role in decreasing nervous system activity and halting anxiety and depletion. Start with 1 capsule twice daily and increase as tolerated to an optimal dose, which is 6 to 8 caps daily. If loose stools occur, back down the dose and supplement with magnesium oil, which is applied to the skin, 20 to 40 sprays. When energy is restored, the dose can be backed down after 12 months. Maintenance magnesium supplementation of 2 to 4 capsules should be continued and increased during times of stress. 2 other critical supplements. One is RX Omega and has significant effects on reducing anxiety, 1 capsule twice a day. Essentials 5-in-1. This is the best activator in one bottle of all the hormones, including thyroid and cortisol, which are critical to regulating anxiety and depression. We utilize 2 capsules at breakfast and 2 capsules at lunch. If you have a sensitive gastric system, we use the delayed release version. This particular formula has the amount of selenium, iodine, chromium, zinc, and the active B vitamins that are specifically required to make sure that the cortisol and thyroid function optimally. The next supplement is Purebiotic. Since the gut is a source of serotonin and other neurotransmitters, it is prudent to use a probiotic for the first few months. The dose is 1 capsule 2 to 3 times a day. Other considerations for anxiety and depression include magnesium oil, Epsom salt baths, GABA, a neurotransmitter that helps with anxiety, 5-HTP, or a precursor to serotonin, which helps with depression. And if gastric inflammation is a major source of depletion, I suggest the probiotic 3 times a day and the probiozyme 1 capsule 3 times a day. My experience in thousands of people in all age groups is that when we optimize the hormones and nutrients, decrease the toxins by drinking water and balancing the mind and the body stressors, energy levels return to radiant and vibrant so that you can have your best life